Dr. David Bilstrom from the International Autoimmune Institute and the Autoimmune Lifestyle. And this is Did You Know? So our case scenario today has to do with preventing viral infections through the wintertime, especially for old people, but also applies to younger people, and how something that you may want to use that is actually the most potent free radical scavenger the body can make. And by scavenging free radicals, you get rid of inflammation, keep away disease, all this, how you can do that all at one time. So you're a 40-year-old nurse practitioner, and into your clinic comes a 68-year-old woman with a long history of Hashimoto's and rheumatoid arthritis. And because you're the local autoimmune disease reversal and prevention expert, she comes to you. Now, she's quite worried because this upcoming winter, this flu season, last year she had 3 different bouts of bad infections, bad viral infections. She thinks 2, maybe 3 were even the flu, and she is really worried about that, but also with the current situation as it is with a viral pandemic, she's very worried about that. Now, you as a practitioner, not only trying to balance your practice, but you have family too, and your mother, who is 70, last year, had 2, maybe 3 flu viruses and a couple different colds. She just had a really terrible time, and you're super worried about your mom this winter about getting these flus. They just knock your socks off, but also with the global viral pandemic, you're kind of worried about that too. Now, you were quite heartened because just 2 days before this patient showed up, you read an amazing article, and it was from 1997. Some of this information is so beautiful and so old. And it comes from the European Respiratory Journal, 1997. Title is Attenuation of Influenza-like Symptomatology and Improvement of Cell-Mediated Immunity with Long-Term N-Acetylcysteine Treatment, NAC. And you look at that and go, oh, NAC, oh, I use it all the time in my practice. It's so good at getting rid of inflammation. It's so good at getting rid of pain and inflammation and brain stuff, kidney stuff, all this. And you read this, and this study that was in 1997 published was this large study in Italy, multi-center, and what they found is that when they gave seniors, 65 years of age and older, 600 milligrams twice a day of NAC, there is a significant impact on their chance of getting viral infections throughout the entire winter, and a significant decrease in the severity. So what they found is pretty much everybody in the study came in contact with influenza A, a bad viral infection, about as bad as they came before the COVID. And they gave half the group 600 milligrams twice a day and half placebo. And they saw that, yeah, everybody tended to get this bug, influenza A, in their system. There was antibodies produced by the system, but only 25% of the time in the NAC group did they actually have symptoms, whereas about 80% of the time, the non-NA people had symptoms. So they also found that most people in the NAC group just had mild symptoms, maybe a little bit of moderate, hardly ever severe, but a huge proportion, well over 50%, almost 60% of the non-NAC group, when they got the influenza A virus, they had moderate to severe reactions. And as we're kind of finding out from the current global pandemic, yeah, you get infections, you don't want to have the severe outcomes. And there was a 400% greater chance in the non-NAC group of getting 4 or more influenza infections in a year, in a winter, than it was for the NAC group. And they followed them for 5 months, and the longer you're on the NAC, the more likely you were not to get symptoms, and if you were, they would be mild. And in the non-NAC group, you're much more likely to get the bad infections. And you tend to get a lot of infections. So you tell your new patient, we can help you a lot with your chronic health issues, including your autoimmune disease. Yes, your fears about an increased risk of infections, including this global pandemic, are well grounded because you have not only autoimmune disease, immune disruption, but you're on chronic use of immunosuppressants because of your rheumatoid arthritis. So you're much more likely to get a bad infection. But because of this European Respiratory Journal 1997, I can tell you that if we give you 600 milligrams of NAC twice a day during this whole winter, we're going to significantly reduce your chance of getting a viral infection and getting any symptoms from it. And if you do get a viral infection, such as influenza A, that this probably could apply to other viruses as well, cold viruses and etc. If you do get it, you're much more likely to get a very mild influenza viral infection symptoms. Thank you so much.